Newborn mortality, India 12th worst among 52 low-income nations. Pack riskiest place to be born, Japan safest. A new study done by the UNICEF has found that nearly 600,000 newborns die within 28 days of their birth in India every year. The study, which revealed that a quarter of global neonatal deaths take place in India each year, also showed that the country has remarkably reduced the under 5 mortality rate. The first 28 days of life, the neonatal period, are the most vulnerable time for a child's survival. And children face the highest risk of dying in their first month of life, at a global rate of 19 deaths per 1,000 live births, said the report. According to the report, India's neonatal mortality rate, deaths per 1,000 live births, is 25.4 and is ranked at number 12 among 52 low-middle-income countries in terms of risk for newborns. India's ranking, though, is better than that of Pakistan's, the country with the worst newborn mortality rate. Read, Pune couple becomes grandparents to twins born via surrogacy using dead son's preserved semen. Though infant mortality in the country has declined considerably, the number of newborns die each year remains unacceptably high. India, with nearly 600,000 newborn deaths each year, accounts for a quarter of the global burden of neonatal deaths, said UNICEF in its global report on neonatal mortality Every Child Alive released on early Tuesday. The report covered 184 countries and India has been ranked 31, keeping the world's 7th largest economy below 153 countries who have better survival rates for their newborns. A year earlier, India was the 28th worst country among 184 nations in terms of neonatal mortality. Also read, 386,000 babies born worldwide on New Year's Day. India leads UNICEF list. The report named Pakistan as the riskiest country to be born with 45.6 newborn babies dying out of every 1,000 births in 2016. The safest country for birth on the list is Japan, where less than 1 in 1,000 babies dies by the time they complete a month. This means Japan's figure is more than 50 times lower than neonatal mortality rates in Pakistan, reflecting the widening disparity in life expectancy around the world. Babies born in Japan, Iceland and Singapore have the best chance of survival, while newborns in Pakistan, the Central African Republic and Afghanistan face the worst odds, UNICEF said in a statement. Globally, some 2.6 million children died in the first month of life in 2016, most of which occurred in the first week, with about 1 million dying on the first day and close to 1 million dying within the next 6 days, as per the UNICEF. The report, however, noted that more than 80% of newborn deaths included delivery complications or infectious diseases such as pneumonia, which could have been prevented with basic solutions such as affordable healthcare and well-trained medical staff.